Well, the current only accepted therapy, although the data for this becomes weaker and weaker over time, is the use of corticosteroids for severe alcoholic hepatitis. In the largest randomized placebo-controlled trial in alcoholic hepatitis ever conducted by Dr. Thurs in England, there was no statistically significant improvement in survival comparing placebo to methylprednisolone to pentoxifylline. And so many of us are now left with, what do we do? Do we treat our patients with steroids or not? I've become rather a steroid nihilist. I only use steroids very selectively in those people that are clearly getting worse because I have nothing else to treat them with. But if I have people with severe alcoholic hepatitis that are stable or look like they're getting better, then I usually don't give them any treatment. And many of them do slowly come around. If they do get worse, I do throw in steroids. I recently had a patient that really got significantly worse. During the hospitalization, I added steroids and he got a complication of steroids, which was psychosis, steroid psychosis. And he ended up dying of his severe alcoholic hepatitis during a prolonged hospitalization, unfortunately. Larsucosterol is a very interesting drug in that it interacts with a protein called DNA methyltransferase. DNA methyltransferase activity and DNA methylation are significantly increased in alcoholic hepatitis. And what this process does is it prevents the DNA from opening up and allowing downstream genes to be produced when they're needed. So when you have severe alcoholic hepatitis and you need those repair proteins to be produced to help the cell recover from severe alcoholic hepatitis, DNA methyltransferase activity prevents the DNA from opening up and unwinding and prevents those genes from being produced, also called gene silencing. What larsucosterol does, it binds to DNA methyltransferase and modulates DNA methylation, promoting the downstream transcription of these necessary proteins to help repair the cell and thereby improves cellular function to recover from alcohol-induced hepatitis and potentially down the road, maybe other hepatocellular toxins as well.